There's a reason why some of this technology costs money. It's because it's incredible. You're taking a single cell of an egg and freezing it, and you're able to keep it frozen until you want to use it. And then you can thaw it and put a sperm inside of it and have it become an embryo that can implant and become a baby. That is freaking amazing. And it is. It's amazing.
I love it. I totally agree.
Why do we act like that should be done at Walmart? That's not Walmart level.
Family building is supposed to be easy, and it can be a shock when it's not. The roller coaster ride of infertility can be a mix of emotions and conflicting advice along the way. As a reproductive endocrinologist and former fertility patient, I not only help patients build families every day, but I remember what the ride was like for me. Hang on tight as we learn together from experts and share stories from infertility warriors with compassion. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. It can be so tough to know when to see a fertility doctor. There are so many misconceptions about what they do, what their goals are. It's hard to know how long to try before you see them. I have here today Dr. Natalie Crawford, my dear friend and reproductive endocrinologist, to help us bust myths around when to see a fertility doctor and fight some misconceptions that are out there. Dr. Crawford is a reproductive endocrinologist and founding partner of Fora Fertility in Austin. She is a clinical assistant professor at the University of Texas at Austin. And you have seen her all over Instagram. You've heard her As a Woman podcast. I'm so excited to have Natalie here today. Natalie, thank you for being here.
Laura, I'm thrilled. Thanks so much for having me on.
Well, I just want to know one question. Why do patients hate coming to see us?
I think that's a really good question. And to be honest, I think it is because nobody comes to see us unless they're having a problem. And that's not a fun visit. That means that you don't have any rapport with patients until there's already an issue. And it's an issue that nobody is expecting or prepared for. And so it strikes them as this very unknown, scary, uncomfortable thing. And anytime something is unknown, it is scary. I mean, that's why you and I are on social media, to try to say, hey, we're normal people. We're just like you. We care about you. We're nice. We're not scary. And try to break down that number one barrier, which we both know is getting into the door or on a visit with one of us or any fertility doctor in their office.
Absolutely. And I just have so many patients that kind of have so many misconceptions before they come in. I think one of the most common is that we're just going to say IVF. No matter what problem they have, like that's going to be our answer for everything. And they're really nervous about that. Have you seen patients tell you that too?
It's very interesting because we're often portrayed kind of poorly sometimes by the media as being a field that's very money hungry. And I'll even use an example. I had a person on Instagram ask me a question and literally said, is this normal or is my doctor just trying to get more money from me? And because that's the perception I think a lot of people have, is that fertility makes big bucks and that's what we're all in it for. And this job is so hard for us to get to. None of us do this for the money. Like we went through so much training. We battled through all this stuff because we truly care about these patients. And I always tell patients, that's a lot more work for me if you're going to do IVF. If there's a way for you to get pregnant without it, that's fabulous. That would be wonderful too. But truly, we want to talk about your goals, your situation, understand everything about you and where you are so that we can have the most data to make a decision that is right for you, both now and in the future for your family goals. And you never really get that conversation unless you're in a fertility doctor's office.
Yeah. I also think people don't have a really good understanding of what reproductive endocrinologists are or how they're different from the OBGYNs that they're seeing or the obstetricians that are taking care of them for everyday women wellness.
I think that's a good point and probably confusing because this is still a relatively new field. So for a long period of time, general OBGYNs did practice infertility treatments as far as to what they could. Reproductive endocrinology and infertility is a fellowship after OBGYN. We deal with fertility every day. So instead of running off to have deliveries or have big OR cases for other reasons, we are truly dealing with patients who are just like you in the same phase of this struggle or this journey, trying to figure out the best way to build their family and understand their options in a field that's really stigmatized and not well talked about. And there's also so much misinformation about our field. So I always like to say we're truly the hormone experts. We love the ovaries. We love hormones. We're really all very, very nerdy at heart because that's what it takes to get to this job. But we also care immensely about you.
And there's so many instances where patients are really nervous to leave their OBGYN, or they just assume that they've done all the testing that they should have and that the treatments like, letrozole or Clomid that the OBGYNs are giving them are they sort of assume that that's all that's out there, that there's not more that we can offer. I can't tell you how many patients I've seen who've been doing just Clomid for a year or two and having cycles and just not really understanding why they're not getting pregnant, and finally come to me and honestly say, I wish I'd come sooner. Like I didn't realize that there was more to understand or more testing to do.
I hear that all the time. And the truth is every regular OBGYN feels really differently in their comfort zone for how they diagnose or treat fertility. And that's really hard for the patient who's a consumer in that environment to know what their experience is compared to what is normal or what is all out there. In reality, I believe that before you take any medications, you really should have a full evaluation, because the worst thing you and I ever hear is, I wish I had known that sooner. I would have made a different choice if only I had known. And so you don't know what you don't look for, and making assumptions is just not a smart decision when it comes to your fertility.
I had a patient this week that honestly thought that she had to try for a year before she came to see a fertility doctor because she had just been told by other people, read it online, but she only had 1 or 2 menstrual cycles in the whole last year. She's not ovulating.
Oh, terrible.
And we're going to take good care of her, but I think that's a great example of you don't have to wait a certain time if you aren't having regular cycles, if you have questions, if you have issues, like come and see us. Let's figure this out.
I always say that, yes, the true definition of when you have infertility or when you need to have an infertility evaluation, like your kind of line in the sand, is 1 year of trying if you're less than 35, 6 months of trying if you're between 35 and 40. And if you're 40, you should really just come see us right away if you have not started your family. But there's the big asterisk about all the other reasons why you should not wait that long. And that is, if you have irregular periods, you need to come in and be seen sooner. If you have severely painful periods that are causing you to pass out and miss work, that's really concerning. If your partner, if you're in a heterosexual relationship, if your partner can't achieve erection, if you can't have intercourse appropriately, then you shouldn't just let the time pass. Those are reasons to go and be more proactive. Or if there's anything in your history that might make you worried, somebody's told you before, or you had cancer as a child, or your partner had a testicle removed or something along those lines, then don't wait the time. Be more proactive if something's not perfectly normal. So these guidelines of 6 months or 1 year, that's for the person who everything appears to be perfect. We're having perfect cycles. We're able to have sex without any problem, and everything seems to be like it should work. That's what those guidelines are for. If that is not you, do not waste time. Come right to see either your OBGYN to bring those issues up, or come see one of us so we can start that workup sooner. There are people who are not hormone experts who say that they are, who are trying to profit off of your fear of infertility. And they are using things that make perfect sense to those of us in the field as, oh, it may take a couple months to get your period back because your brain has been suppressed by taking the birth control pill. That's how it works. So we're not surprised by that information. But they use it as a fear tactic that you've done something wrong to hurt your fertility. And the way to cure it is to purchase whatever it is that they are selling. And I really think that that does a disservice to the entire fertility community. One, because it makes women take blame for that they cause something. And two, it puts a barrier between the true experts, the reproductive endocrinologists, and their patients because they're hearing this third voice. And I'm not saying that there aren't people who are in the fertility community who are practitioners of different forms or fashions that don't have an expertise and a voice that's very valuable. But if they do, it should never be based in fear. Nobody should use a fear-based tactic to try to sell you something. That should be a huge red flag in your brain. And if you have questions, this is why you need to have a doctor you can trust and have a good relationship with, because very often there's an explanation for it that you just don't know because you didn't go through all this training. And they're giving you the sexy online solution that makes sense. Oh, I did something wrong, but I can fix it by buying this blah, blah, blah. And that's just not the thing. So I always think about when it comes to misinformation, if it sounds too good to be true, it probably is. If it's based in fear, it's probably false. If somebody who's giving this information profits off of it, as far as selling you a book, a supplement, a cleanse, a course, then they have an ulterior motive that isn't just, I'm going to spend my free time on social media outside of my practice so that I can educate you because I want you to have the information. Understand how your body works. That's the most empowering thing you can do for yourself and for your future fertility. And then when you hear this misinformation, you can call their bluff on it. You're going to say, that doesn't sound right to me. And you can have other more reputable resources.
Yeah, I think a red flag for me for figuring out if something is medical misinformation is if it's selling certainty. Like, I know exactly why this is happening to you, even though I haven't really learned about your personal situation. And there are some instances where actually delaying care can result in harm. So if somebody started on birth control pills because of very painful periods when they were young, it could be because of endometriosis. And when you stop those pills to try to conceive, if you conceive right away, that's great. But if you aren't having periods, you start having more painful periods, it could be that endometriosis is getting worse and worse. And I don't want people to delay care, not seeking an expert opinion.
Completely. And I think another good example is PCOS. If you really have irregular periods, you could get endometrial cancer. And I really do think that some of these people pushing the harm of birth control pills for your long-term health, which has not been proven and looked at in multiple studies over and over again, is that we're going to have a group of people who have complications with their fertility, who develop endometrial cancer, who let their endometriosis progress, and they now have blocked fallopian tubes or low ovarian reserve or other consequences because birth control pills are not just for birth control. They're combined oral contraceptive, and we use them all the time to help control your hormones in situations which it would be beneficial for your health. And some people don't want to be on them, and that's fine. That's a different discussion. But I think being afraid to be on them because of what people are telling you online, especially those who profit from that information, that's just a dangerous place for medicine. It's one of the things that really gets me riled up about the internet. You and I could talk about that on a whole other episode sometime, because the misinformation game is really hurting our patients who are already so vulnerable and really who want to be empowered. They're being taken advantage of. It's okay to advocate for yourself. And I try to tell people that all the time. If you're not getting what you want from your doctor, no matter the field, find a new one. You're allowed to change. You're allowed to change clinics if the clinic isn't working for you. You're allowed to find a place that supports you and that works for you and that you feel like you're getting what you need from that place. And you're always allowed to be an advocate for your own health.
I love what you talked about, the person being a little bit older and being worried about waiting. I also see the opposite. I see ageism for younger patients who want to see a fertility doctor and get told, oh, you're young, you'll be fine, just keep trying. And they'll be trying for 2 or 3 years and they don't know to advocate for themselves and that it's okay. Even if you're 25 and you've been trying for over a year, yes, you should get testing.
Same. I had a patient travel to me from a more rural area in Texas once, and she was 20, but they'd been trying for she's been married, they'd been trying, and she wanted a large family and she was ready to have her family, and nobody would take her seriously. Nobody would give her a fertility evaluation. And when she came to see me, I was like, absolutely, at 20, you should be pregnant after trying this long, 100%. Something is up, and something was, her intuition was right in that standpoint. But she was getting, like you said, ageism, saying, you're young, just keep trying, it'll happen. And she had to be the one, literally, she drove across the state to come see me to get treatment because nobody would take her seriously close to where she was. So I think that that's hard. And that's part of why you and I both are on social media, why we're so fortunate that so many fertility doctors are trying to spread this message to people, and why we both really encourage patients, people to share their own stories if they feel comfortable, because that's the number one thing that can inspire you or make you feel empowered, is knowing that you're not alone and knowing that you have options. Because when you feel like you don't have any options, that's when you really feel like there's no hope, that there's nothing to do, there's no hope, it's not going to work. And the truth is, that's rarely the case. There's usually lots of options. It's about whether those options are right for you or not, but we often have options. And so we need to get you into that next step and into our offices so that we can be the ones to help guide you on that next stage of the journey.
If somebody is decided to advocate for themselves and take that next step, and they've made an appointment and they're kind of getting ready for that appointment, what can they expect in that first visit or testing? It'd be nice to not have such an unknown before they got there.
I think the first thing everybody should do is make sure you're talking to whoever's scheduling your appointment to understand what to expect at your clinic, because especially in the time of COVID, it's all really, really different right now. For us, so I'm at Fora Fertility. That's a fertility practice we own here in Austin. We're still doing virtual visits for our new patient visits. Are you doing virtual visits or are you doing in person?
Yeah, we're doing virtual consults, and then we'll see them in person, of course, for testing and treatment.
So that's what we're doing. We tell them that our new patient appointments broken into two. So we have the virtual consult where we sit down on the computer, go through all your history, you fill out all your form, talk about fertility at length, make a game plan, and then you'll come into the office for the next part of the visit, which we call the next steps, and that's for your testing. And then once all the testing is complete, we'll sit back down virtually and go over all the results and come up with a game plan. From there, we're going to usually talk you through some of the tests that we are going to order. I like to say, imagine that there's a vault inside your ovaries, and that's where all your eggs are kept. And every month, a group of eggs comes out of the vault. And the size of the group is proportional to how many are left inside. So when you're younger and you have more eggs come out every month. And when you're older and you're getting closer to menopause, fewer eggs come out every month. From these eggs, one is chosen to ovulate, the rest of them die, and the next month you have a new group. So we can't see inside that vault, but we can evaluate the eggs outside the vault, and it gives us an idea. It's not perfect, but it gives us an idea of where you are on the timeline of running out of eggs. And I always tell patients, let's think of it like categories instead of a discrete number. Are you normal, above average, below average, or critically low? Because once we've placed you in a category, then we know, okay, do we need to act now or never? Is this going to be a marathon that I'm running or a 5K? Like, what does the road ahead of me look like? And that number is really important for how many kids you may want and your age. And then there's going to be a semen analysis to evaluate the sperm. So the big things are tubes, uterus, ovaries, sperm. And those are the big four that we're looking at to start with, that we're going to gather information on. And I'm going to do a plug because I talk about it all the time. You should also get preconception testing done at this time if it hasn't been done by your OBGYN. We do this to make sure you have the highest chance of having the healthiest baby possible. That would include usually preconception genetic carrier screening, checking your vaccination status to see if there's any booster vaccines that could help you have a healthy baby for some viruses we know cause birth defects, and then also checking for your blood type. So that's pretty basic preconception testing. And then we'll have all of that information, sit down at a follow-up visit, go over it all, and talk you through what all the options are, recommendations, what makes sense for you, chances of conceiving, and go from there.
When I was struggling to have my family, and I was very reluctant to go see, it was my chief resident, but we worked together. And I just remember feeling, I don't know if I want them to find something wrong or if I don't want them to find something wrong. And so kind of preparing in between, asking your clinic, how am I going to get these results? Like, are we just going to go over it at the visit, or can I have access to them and look up what's normal online beforehand? I think it's really nice to kind of set those expectations, and ask your clinic about that. It can be really helpful.
I agree completely. Communication styles vary immensely at clinics. Some clinics put information in a portal. Some email you. Some will call you. I always say, if you're not a call person and that's what your clinic does, let's kind of foresee what problems are going to happen if that's how you have to communicate with people. Are you going to step up and be able to talk to people on the phone? Or maybe that's not the right clinic for you. So you have to find a communication way that's going to work for you, and you want to know what it is. And I also think it's important to kind of ask, as you get further on in this truth into the process, who are you going to be seeing? Like, who sees me for these visits? And just make sure your expectations are set appropriately.
What do you think about this move towards doing testing at home? Like, there's a part of me that loves access to testing, but I have seen patients really make choices without the right interpretation that I question.
I feel really strongly about it, but also split like you do. I do think anything that improves access and potentially could get you in my door when you otherwise wouldn't have is good. So I do think there are cases where if you get the testing done and it's abnormal and that tells you to come and make an appointment, then that was worthwhile. The testing is not a substitute if you meet the definition of infertility. You still need to come in and see. So getting normal results on at-home hormone testing and at-home sperm testing doesn't mean all is good and just keep on trying. That is increasing the prevalence that you might have unexplained infertility, which you're going to need intervention, most likely to get pregnant. So what I have seen is that people do at-home testing because they've been trying for a year. It is good. And they say, everything's good with me. I'll just keep trying. And really at that point, they're kind of wasting more of their own time. And then they get frustrated when they do come and see us and they realize and they hear percentages and what their odds of getting pregnant are, and they're very frustrated. I also want to say that a lot of these at-home testing prompt you that they are saving you money by doing the at-home tests. And that is not always the case. Many times insurance companies may cover some of the fertility testing. It's different. States have different regulations. Every insurance company is different. But here in Texas, it's mandated to provide testing coverage. So you don't have to provide treatment coverage, but testing coverage. So any at-home test you buy is not covered by your insurance and just money out of your pocket, where if we did it in the office, you'd just be paying your deductible, which is going to be less. And so I think that's important to understand because they sell themselves on the fact that they're saving you thousands of dollars, and that's not always the case. I also don't like that when they make it sound like our offices are always cash-based and too expensive for anybody to afford. So I think some of the marketing strategies of these at-home testing companies are pushing patients actually further away from us versus encouraging them to come to us. So I feel mixed about it also. I do think that early in your journey, when you don't meet the criteria for infertility or before you're ready to get pregnant, testing your hormone levels may be a helpful thing because you may do something different if that information comes back abnormally low. A normal value is only reassuring in that very temporary time frame because it's a one-time look, doesn't tell us anything about the future. And if you're already meeting infertility or struggling to get pregnant, it is not helpful testing. You should just come to us.
Yeah, I really appreciate your pointing that out. I will never forget a patient who came to me at 40. This was years ago, so I don't think there was as much education out there. This might have been even 10 years ago. She was 40 years old, and she had been checking her FSH every 3 to 6 months with her OBGYN since she got married when she was 35. And she just said, well, my FSH is normal, and so I'm fertile, and now we're ready to start trying. I was checking it in case it ever became abnormal, then I would start trying because I do want to have a family. I love your point about, well, if you're not conceiving, just because these tests are normal does not mean that you don't have an issue. But on the flip side, if these tests are, quote, normal, and I know you can't see me do my air quotes, that also doesn't mean that you can delay your family by assuming that you're fertile if you're ready to start your family for other reasons. So I have seen it used in that way as well, as sort of false reassuring.
So I think one of the biggest issues is that if we delay getting you to that first child because it takes a long time to get you into our office, we have to understand what your diagnosis is, and treatment isn't always a straight pathway. Sometimes it takes time, even with our best treatments to get you pregnant. It may become impossible to get pregnant at an older age from age-related reasons alone. And I think it brings up one other really important point is that IVF is the best thing we have. It just is. It's the only thing that really exceeds natural conception rates. And so that's fabulous. And we use that a lot because it helps many different reasons. It is not a guarantee and it's not 100% successful. I see patients who say, oh, well, I'll just do IVF because that will work and give me a baby. And that's not always the case. And sometimes we can't predict who's going to have a harder time than other people. And so giving yourself a buffer that it's not just often a one and done situation when it comes to that treatment is important to understand so that we don't delay that initial baby one, because we really want you to have, yes, that baby now, but also that whole family that you've been dreaming of. We want you to have the whole pie.
Any other myths or misconceptions you've heard from people that would be helpful to fight?
I think one thing that we haven't really talked about is women coming in proactively to freeze their eggs for social reasons and how empowering that can be, not just in the current moment, as far as letting your relationships evolve and focusing on career and not worrying about your fertility. I remember being a medical student in a coffee shop with my two friends talking about what fields we wanted to go into and how old that would mean we would be and could we have kids and what would that mean and what's the lifestyle like, and truly evaluating career versus family at those moments. And I love seeing younger women come in and freeze their eggs. And even though it's not a guarantee, open that door up. Success rates are better when you're younger because your eggs have more genetic normalcy to them and you have more of them, and it's a numbers game. And so I think there was a lot of media telling people that egg freezing wasn't worthwhile. It wasn't a guarantee and it wasn't an insurance policy. And although I agree with some of those things, I think it's very worthwhile. I think you need somebody to counsel you through it. And I always say it's not an insurance policy. It's actually one of the things I hate when people call egg freezing an insurance policy on your future. Egg freezing is playing the stock market. You're making an investment in yourself. You're making an educated investment. You're not just blindly doing it, but the return on that investment is going to depend on the market when we withdraw. And we don't know what that's going to be. We don't know what the situation will be. And so we have to say time is the currency there. But this investment is worth it because the alternative is to do nothing. And we know what that pathway looks like. We know that infertility increases as we get older. We'll have more miscarriages. We may not have the family we want. Utilizing earlier access to freezing technologies of eggs and embryos truly is a tool that is currently changing the dynamic and the face of reproduction for women because it's allowing you to have more control over having kids at an older age. And it is making the pathway more linear. If I get 20 eggs from you at age 30, it's going to be way easier than if I get 10 eggs from you at 37. There's just no other way to put it. But I always want to encourage young women, if you're considering freezing your eggs, or even older women, wherever you are, you should go and get an evaluation. You should talk to somebody. You should consider the process. Always know that cheapest isn't always the best. You pay for what you get for. I understand all of it's expensive, but there's something about, if you shop at Walmart, that's really different than shopping at Neiman's. And there's a reason why some of this technology costs money. It's because it's incredible. You're taking a single cell of an egg and freezing it, and you're able to keep it frozen until you want to use it. And then you can thaw it and put a sperm inside of it and have it become an embryo that can implant and become a baby. That is freaking amazing. And it's amazing.
I love it. I totally agree.
Why do we act like that should be done at Walmart? That's not Walmart level. And so I just always say, when you pick a clinic, pick a place that's going to work for you because you trust the care team, you trust the doctors, their communication style works for you. I think that location and money are the two least important factors truly in what you're choosing. Because if you have to drive 20 extra minutes, but you have a completely different experience, worth it. If you pay $2,000 more, but you get an extra child or you get your family because the technology was better, worth it. So as in many things with life, you often get what you pay for. So if somebody's advertising the dirt cheap prices, buyer beware.
I've definitely seen people who have known about egg freezing for the past 5 years and just kept waiting and wished that they'd come a little bit sooner.
It just keeps doors open, and truly life is unpredictable. We all know that. And having more doors open is just going to give you more options in the future.
Tell us how we can find you.
I'm on Instagram at Natalie Crawford, MD. I'm on TikTok as well. I host the As a Woman podcast. I have a YouTube channel, which is called Natalie Crawford, MD, with lots of great fertility videos that are about 10 minutes in length. And then I practice at Fora Fertility here in Austin, and you can find us on Instagram or online at Fora Fertility.
Thank you, Natalie.
Thank you so much, Lora.
Thank you for being here today. I just loved talking to Dr. Natalie Crawford all about what it's like to decide when to see a fertility doctor. There are so many misconceptions about how old you need to be or how long you need to be trying before you see a fertility doctor. And what I really took away is any time is a good time to talk to a fertility doctor. It's all about getting testing, making a plan that's right for you, and learn how to advocate for your own care. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. If you like this episode, let us know. Give us a 5-star review and follow the show wherever you listen to podcasts. Baby or Bust is produced by Mark Ramsey, Jaime Solis, and Greg Moga. Executive produced by Paul Anderson, Nick Panella, and Andrew Greenwood for Workhouse Media. Baby or Bust is a Mark Ramsey media production.